Namaste, hello to everybody. This is Dr. Malladi Srinivasa Sastri. I'm a senior consultant psychiatrist at the Aragya Raksha Clinic, Visakhapatnam. I'm going to talk to you about an important topic: when to see a psychiatrist. We all may go through periods of sadness, grief, conflict, and stress. These are all common in our lives. It is always ideal for us to have the necessary coping skills to handle our problems all by ourselves without needing any professional help. However, it's not always possible, is it? So is there a simple thumb rule to ask yourself, when should I see a psychiatrist? Yes, there is. So if you feel so distressed that you may need immediate help, or if your mental health problems are lasting longer than you can handle, surely those are the times you should see a psychiatrist. In case you are wondering when to visit a psychiatrist, here are a few signs that you should never ignore. 1. Inability to deal with an emotional distress. 2. Relying on substances for coping, like alcohol, for instance. 3. Emotional turmoil affecting the body. We may not be eating well, we may be becoming tired, and if it is anxiety, it is troubling my system, my heart is racing, all sorts of things that can affect our body. And your problems are affecting your relationships. However, it is seen that a lot of patients actually end up seeing other doctors, even though the problems are mental health in nature. So why is it common for patients to visit other doctors before seeing psychiatrists? It may be the heart ache, like in palpitations of anxiety, or it could be the tummy upsets of the anxiety or irritable bowel syndrome. It could be bodily pains, which can be seen as somatic symptoms of depression, or even things like headaches, sleeplessness. So it happens because mental illnesses like depression and anxiety can present as physical symptoms of pain and discomfort. So patients may end up going to a neurologist with depression or anxiety, or an orthopedician because they think the body pains are muscle or bone in nature, muscular or bony in nature, or to a heart specialist because their heart is pacing and they want to seek help, wanting an ECG done and so on, or a gastroenterologist because they are having very irritable bowel. These are related to anxiety disorders, and all these are treatable by a psychiatrist and should be the first person to contact. So before you make an appointment, make a list of the specific symptoms you have noticed and for how long. The key personal information, including any current major stressors or traumatic events in your past. Your medical information, including other physical or mental health conditions. Any medications, vitamins, herbal products, or other supplements you take and their doses. And if you have any questions to ask your doctor, please make a note. And what do you expect in assessment sessions? As a part of assessment, your psychiatrist will first listen to all your concerns carefully and try to understand them from your point of view. The psychiatrist then asks you questions about your health, your relationships, and your family history. Be prepared for a lengthy assessment as it does take time. And once the assessment is done, it will be followed by decisions on treatment choices and follow-up. Please do have patience. There are no quick fixes. And what do you expect? What to expect in treatment session? See, once assessment is done, psychiatrist will focus on introducing a suitable treatment plan which may consist of prescribing medications or offering a suitable psychological therapy. Remember again, there are no quick fixes. It is important to adhere to treatment and to attend regular follow-up. Communication is crucial between the patient, that is you, and the psychiatrist during all reviews. See, based on your feedback, psychiatrist can recommend changes to your treatment options if the current treatment does not work for you. Okay, quickly, psychiatric disorders range from young children to the elderly, and this can be witnessed from the range of psychiatric disorders both children and adults suffer from, such as attention deficit and hyperactive disorder, autistic spectrum disorder, school refusal in children. It could be depression, anxiety, psychosis or obsessive compulsive disorder or substance misuse in adults, or it could be dementia, psychosis and depression in the elderly. It is important that you care for your mental health. Without it, ensuring a healthy body and a promising life ahead is impossible. Visiting a psychiatrist should not be seen as a sign of weakness, but a healthy sign of seeking help when necessary. Mental health problems can sometimes be perplexing, making it difficult for the patient to find people who can understand their suffering. Please understand that psychiatrists are therefore trained to deal with not only a range of mental health disorders, but also on aspects of confidentiality, assessment of risks, effective communication, and empathy. I conclude with Michelle Obama's words to raise mental health awareness. Whether an illness affects your heart, leg, or your brain, it is still an illness, and there should be no discrimination, says Michelle Obama. Please do understand, you need yourself to be empowered and to be responsible so that your health is your responsibility. Alright? So take care and be healthy. Thank you for listening.